let's just go down the therapeutics then that are available. So trastuzumab, DKST, and trastuzumab ANNS. So those biosimilars, trastuzumab, you're converting?
Yes.
So taking active patients who are on them and making the conversion.
Correct. After we talk about it with the patient, we want their approval, we want their buy-in, we want to make sure they feel comfortable, we want to make sure they understand they're not getting an inferior product, you know, and we also want them to be aware so that they can help us. They can help us, you know, and notify us if they notice any differences or changes. Once again, these are biosimilars. They are highly similar, but still, we can see unique differences in patient to patient, very rarely, but they can happen. When I say unique differences, sometimes a patient may have a side effect with one that they didn't have with the other. And so that's why we want to make sure the patient's aware. We want to get their buy-in. We want them to be aware to look out for side effects, and we want them to notify us if they're having any issues or problems that are unique.
Bevacizumab AWWB.
Yes, we are using that. We're clinically indicated. You know, it's got most of the indications as the reference product. So yes, where we can use it, we're trying to use it.
So I know, I think that there is also one of the reasons why we would see kind of this hindrance in adoption rates with some of the biosimilars in oncology is that, you know, they don't carry all the indications that the reference product has. And I think a lot of times providers don't know that it's because of it's an orphan indication. And it's not because there's a difference in mechanism for ovarian cancer versus lung cancer that, you know, the FDA didn't grant this biosimilar an indication in that setting. So if you go into the NCCN guidelines, they actually recommend that, you know, we recommend that, you know, for these indications, besides the ones that are already, you know, only approved on the labels. So I think that's important to understand because, you know, as we see more indications that the reference product may be getting, you know, the biosimilars may not have that indication. And the difference of that is because of it's an IP related issue and not because of efficacy or mechanism of action of the drug.